Assalamu alaikum. My name is Hiba Fahim, roll number BP1650083, group number 18, and today my topic is ischemic heart disease, anginal syndrome. So first of all, we will discuss about what is ischemic heart disease. It is usually a disease of the coronary artery which leads to the ischemia of the heart muscles, also known as CAD, coronary artery disease. Coronary arteries supply blood to different parts of the heart. As you know that different arteries supply blood to different parts of our body. So for heart, there are specific arteries known as coronary arteries. So these arteries insufficiency to supply blood leads to the ischemia of that particular area of the heart muscles. How do we know that we have ischemia? Angina is the symptom that is produced when there is ischemia of the heart muscles. What is angina? Angina pectoris is chest pain or discomfort in the heart muscles or a squeezing feeling or pressure felt in chest which can extend to the shoulders, arms, jaws or back. It has different types: stable, unstable and Prince metal. First of all, stable angina. It is also known as classic and new onset angina, and as the name shows, it has a stable character. The most common type of angina is stable angina, and the pain stays for a few minutes. The pain is intense and usually lessens with rest. Second form is unstable angina, also known as crescendo angina, and it is a period of rapid pain escalation which occurs even when the person is resting. It is mostly the unexpected kind of angina, like the patient is not expecting to have an anginal pain, and when he feels that pain, it is the unstable kind, which lasts for more than 30 minutes, more than 20 to 30 minutes, and it is a more severe form and can lead to myocardial infarction, also known as heart attack. The third type is Prince metal angina, also known as variant angina, and this type is similar to the unstable one but is severe in intensity, and the reason is due to coronary artery spasm. There are different causes of the above types of angina that I just explained to you, and it is characterized by different symptoms, so the management of each type is different as well. First of all, we will discuss about the causes for all type of anginas. For a stable one, it is mostly due to exertion in the body, exercise, emotional stress, or it could be underlying atherosclerosis. For the unstable one, artery occlusion due to atherosclerosis and thrombosis. What is artery occlusion? It is mainly the narrowing of artery due to the deposition of fats or thrombus. For Prince metal angina, spasm of arteries can cause stenosis and blockage of blood flow. What is stenosis? Again, it is the narrowing of the artery and eventually the blockage of blood flow. So, spasm is mainly caused by exposure to cold or stress. Other factors are arteriosclerosis, that is the inflammation of the arteries, which again narrows the arteries, smoking, heavy meals, weather changes, mostly cold weathers, medication that narrows blood vessel, and use of illegal drugs such as cocaine, etc. All these eventually narrows our arteries and stops or lessens the blood supply, resulting in CAD, coronary artery diseases. Then there are some picture indications of what I just explained. Atherosclerosis, you can see the deposition of fats and the narrowing of the lumen of artery. Arteriosclerosis, the inflammation in the arterial wall and the narrowing of artery. And again thrombosis, the deposition of thrombus, that is blood coagulation inside the artery that prevents the flow of blood or lessens it. Then we'll talk about the symptoms. What are the symptoms? How does a person know that he is feeling anginal pain? First, he will feel chest pain mostly at the left side of the chest or stabbing pain instead of chest pain at times. This pain will extend to the discomfort in neck, shoulder, arm and cause dizziness, headache, fatigue, nausea, and in severe cases, shortness of breath or sweating. The treatment and management of angina. Pharmacologically, we give beta blockers, calcium channel blockers, angiotensin converting enzyme inhibitors, ACE inhibitors. That is my subtopic, and I will be discussing it soon. The short acting nitrates, antiplatelets, and statins. All of these are a very useful treatment in anginal pain. Non pharmacologically, we can give relaxation therapy, physiotherapy, relaxation for the mind, as angina is mostly caused by emotional stress. Physiotherapy increases blood flow overall in the body, so it's a good way, good non pharmacological way. Then exercise also increases blood flow overall in the body. Smoking cessation, as smokers have a higher chance of mortality by myocardial infarctions or heart diseases than non-smokers. A healthy diet, low-fat diet, angioplasty, stunting, or coronary bypass surgery. All these methods are again for the severe cases when all of the other treatment is not working. Now we will talk about my subtopic, that is ACE inhibitors, angiotensin converting enzyme inhibitors. What are ACE inhibitors? It stops the conversion of angiotensin 1 to angiotensin 2. I will be discussing the mechanism of action in the next slide. For now, I will tell the uses. ACE inhibitors help relax veins and arteries to lower blood pressure. They have a vasodilating action and are an indefinite treatment in an anginal pain. By indefinite treatment, it means that they are not actually, the original reason is not known, but uh, they are very important treatment in coronary artery diseases. They also improve outcomes in patients with coronary artery diseases, heart failure, hypertension, and etc. Now, another use is they affect the endothelium of arteries, which helps in attenuating the progression of atherosclerosis. Means they stop the progression of atherosclerosis as well, other than vasodilating. Thirdly, they reduce aldosterone level and increases mineral retention in the body. They can increase preload and afterload. They can further be classified into short acting, medial acting, and long acting ACE inhibitors. For short acting, it includes captopril. It has to be taken thrice a day because it's a short acting drug. Medial acting includes enalapril and quinapril. Long acting includes ramipril, perindopril, lisinopril, and spirapril. It is taken once a day as it is long acting and acts more time. Now we'll talk about the mechanism of action that I was discussing about. We are taking captopril as an example. So now what happens is, let me put on. Captopril prevents the angiotensin 1 enzyme, or inhibitors prevents the angiotensin 1 enzyme to be converted to angiotensin 2 enzyme. This in turn inhibits the reduces the binding of angiotensin 2, here you can see, to the receptor at the smooth muscle membrane of the arteries, this of the heart muscle, sorry. This in turn inactivates the G protein on the muscle membrane, which leads to the reduction in IP3 and DAG. The reduction in IP3 and DAG leads to the reduction in intracellular calcium levels and the inactivation of phosphokinase C. This ultimately closes the calcium channels on the smooth muscles membrane, which leads to the relaxation of smooth muscle, leading to vasodilation. As you can see in this diagram, the constricted blood vessel is relaxed, the lumen is widened due to the action of ACE inhibitors. Now we will discuss some side effects of ACE inhibitors. It is dry coughing, increased potassium level or hyperkalemia, fatigue, dizziness from blood pressure going too low, headache, and loss of taste. Now, I'll discuss about my case study. ER, a 62-year-old woman with a long history of angina pectoris, has survived 1 out of hospital and 2 myocardial infarctions. She is not considered a surgical candidate for CABG because of severe cough. By CABG, it means coronary artery bypass grade surgery, and by COPD, it means coronary obstructive pulmonary disease. Her current medication includes oral insusorbide mononitrate 60 mg every day, oral metoprolol 50 mg BID, oral diltiazem CD 250 mg every day, fluticasone 2 puffs BID, albuterol 2 puffs as needed PRN, NTG spray 0.4 mg PRN chest pain, and enteric coated aspirin 325 mg per day. Would the addition of ACE inhibitor be beneficial for ER at this time? So now I'm going to solve this and answer this case study. I made some soap notes. So the subjective is the chief complaint: 62-year-old woman with an ongoing coronary artery disease and angina pectoris, and the medical history includes 1 cardiac arrest, 2 myocardial infarctions, and angina pectoris was her long lasting history. So the object is coronary artery bypass graft surgery cannot be carried out due to COPT, as I discussed, and the vitals are not given, so I'm not going to discuss it. So, what I assessed from this study is that a 62-year-old woman has an ongoing anginal pain, COPD, which can further lead to heart failure if not kept under stable conditions. She is, however, been treated with beta blockers, nitrates, calcium channel blockers, antiplatelet, and corticosteroid and bronchodilators for her COPD. So, what I planned for this patient is to the above already giving medicines, add Ramipril 5 mg BID or 10 mg per day per oral. Why? Because ACE inhibitors are very essential part of CAD therapy or pharmacological therapy of CAD. I also added Lipitor 10 to 80 mg per day per oral according to the patient's requirement, as statins are a very important part of the treatment in CAD, and this patient has not been given any statins and she already had 2 myocardial infarctions and 1 cardiac arrest. Other than that, I planned for her a daily routine BP checkup which she can do on a self basis, and serum cholesterol profile on a regular basis to check her cholesterol levels. Exercise is not as such recommended as this patient is already suffering from COPD, and it could add to her breathing problems. Cessation of smoking if the patient is a smoker, as I already told you earlier, that smoking increases the chance of mortality and even heart failure in cases of CAD. Angioplasty or stunting should be done if the pain persists, as bypass is not possible because of the age and other diseases present in ER. Proper checkup of her condition and monitoring of her medication should be done on a regular basis to prevent any fatal events from happening in the future. Okay, this was all. I hope it's clear. Thank you.